श्री डॉक्टर राजेंद्र ए बड़वे, कैंसर सर्जरी के क्षेत्र में एक जाना माना नाम। मुंबई स्थित टाटा मेमोरियल सेंटर के डायरेक्टर और सर्जिकल ऑन्कोलॉजी डिवीजन के प्रमुख डॉक्टर बड़वे ने कैंसर ट्रीटमेंट को एक नई दिशा दी है। कैंसर ट्रीटमेंट में विशेष योगदान के लिए उन्हें देश ही नहीं विदेशों में भी कई सम्मानित अवार्ड से नवाजा जा चुका है।
Cancer for a layman is fear. It means death. Whereas in reality, cancer is less understood and hence misunderstood. If you look at many other diseases that affect the age group that affects cancer, these are diabetes, blood pressure, and the way we accept diabetes or blood pressure is, well, it's a disease and I want to take some tablet. Maybe it is for lifelong. As against that, cancer instills fear. दिल में एक डर है, भय है. Now imagine if I were to see 100 cancer patients at age 45, barely 60 to 70% of them would make it to age 60. Whereas if the same diagnosis was either diabetes or blood pressure, this 60-70 would not be 60-70, it would be less than 50%. And yet, we fear cancer and we don't fear diabetes and blood pressure. What needs to be understood is cancer, if detected early, is immensely curable. Medically, if you see what cancer is, it's corruption. It's corruption of cells. Cells defy the rules and regulations of body and start growing. And there are simple causes of cancer which are preventable. I would enumerate three of them. The first one is tobacco, the second is obesity, and the third is personal hygiene. To a great extent, all these three are correctable. The types of cancers are medically carcinoma, sarcoma and lymphoma. Lymphoma leukemias are also called as non-solid tumors, whereas sarcoma and carcinoma are solid tumors. If you look at the numbers across India for these, we have on an average about 90 to 100 for every 1 lakh population every year. The same number in parts of rural India where we have solid documentation for the last 15 years, it's about 40, 45. And the same numbers, if you were to go to United States, it would be about 300 to 350 for every 1 lakh population every year. So we are much better off in our villages. If I were to elaborate on that, the numbers in our villages are dream numbers for United States. In fact, the Bill and Melinda Gates Foundation have pushed in lots of money to understand why in some pockets of India the cancer is extremely low, and can they export something from here to United States to see if cancer can be reduced there. In India, there are three kinds of common cancers. The first is tobacco related. The second is uterine cervical cancer in women and penile cancer in men. Both these I have put together. Penile cancers are not very common. It is the cervical cancer that is common, but both are related to poor personal hygiene. And the third commonest cancer is breast cancer, and that has a strong relationship with obesity. Let me tell you that there is nothing unique about cancer. The signs and symptoms of cancer are similar to many other problems that we commonly encounter. To give you an example, cough. Now, I'm sure we get cough about 2 or 3 times a year. Almost all of us get it sometime or the other, but that's not the symptom for cancer. A cough that does not get relieved in 10 days, 15 days, 1 month is something that needs to be worried about. So, symptoms of cancer are similar to many other symptoms which are very, very common, but when these symptoms are persistent, persistent constipation in somebody who is non-vegetarian in his regular diet is something that needs to be worried about. As against that, if you look at a lump in any part of the body which is painless, and it's not something which has been there for donkey's years, something which is not there for a very short time either, so something that has been there for an intermediate time, painless lump in any part of the body. Any ulcer in any part of the body, maybe it's in the mouth, it's in any other part of the body, again an ulcer which is not healing and it is rarely painful. It's rarely painful. So, cancer at the beginning is relatively low in symptom and is painless. As against that, a cancer that is very advanced produces intractable pain and it is frightening. It is this intractable pain that makes cancer frightening. The solid tumors that I mentioned just now, carcinoma and sarcomas, are divided into conventionally 4 stages. Stage 1 is confined to the organ where it has originated and it is small. Stage 2 is either it is much larger there or has spread to lymph glands in the vicinity. Stage 3 is spread into these 2 areas in a much larger amount, and stage 4 is leaving these grounds and settling somewhere else in the body, some other distant organ. Now, once the cancer leaves the primary organ and the lymphatic basin and goes somewhere else, it is no more curable. Cancer is immensely curable in stage 1. The cure rates are anywhere up to about 80%. Cancer is slightly less curable in stage 2, about 50 to 60%, and in stage 3 it's about 30 to 40%. But once an individual goes into stage 4, the cure rates are not there. Then the goal of treatment is to shake hands with the cancer and try and prolong meaningful life with good quality. Cancer is diagnosed by some good radiology pictures. It could be CT scan, it could be MRI, it could be a plain X-ray. Cancer is also diagnosed by doing a needle aspiration. Now, this is a very, very important investigation wherein a doctor puts in a small needle attached to a syringe inside the lump or inside the place where cancer is and sucks out a little bit of cells. These cells are then squirted on to a slide and an experienced pathologist looks at it under the microscope to tell us whether there is cancer or not cancer. Mind you, if there is a clinical suspicion or X-ray suspicion of cancer, a negative needle aspiration does not rule out cancer. If the aspiration is negative, it might have missed the cancer bearing area. So, it is mandatory to do some additional test if the test is negative when the index of suspicion is very high.
Like, share, subscribe for more such informative videos.